All right, thank you all for joining us. We have a lot of information to cover today. So we're going to go ahead and get started. And this will be recorded. So if folks kind of miss the beginning, then they can always check out the recording later. So let's dive in. So today we have some announcements. We'll have both a situational update for COVID as well as monkeypox. We will cover the COVID-19 guidance changes that have come through the CDC. And so we have updated some of our guidance as well. And then we have a new case reporting tool. And then we'll cover our normal resources. Not sure that we'll have time for Q&A today. So if you do have a question, go ahead and put that in the chat and we will at least follow up in the follow-up email and answer those questions if we don't have time to get to them. So our first announcement, I am going to welcome Des to the call. She's from our vaccine equity team, and they do have some clinics that they're doing for schools and others. So Des, if you are on, feel free to unmute yourself and join us.
Awesome. Thank you, Kat. Hello, everyone. Good morning. Thanks for having me, and I promise I'll be brief because I know you guys have a busy meeting. So like Kat said, my name is Des Hartung. My pronouns are she, her. I'm a program coordinator for the vaccine equity team here at PCHD. Our program is a 3-year grant. We're about a year in right now. Our primary goal is to provide underserved, at-risk, and minority populations access to COVID-19 vaccinations and health education. We aim to accomplish this in a variety of ways. We do like mobile clinics in the community and specific events, and we conduct outreach via tabling, stuff like that. Our program has various strategic plans, but a major target population we're trying to reach right now is youth and their caregivers. We've hosted a couple mobile clinics at the schools thus far, and I'm sure you guys are familiar with the PCHD clinic's involvement in those back to school events as well. We kind of helped facilitate those in July. So I wanted to speak to you today about kind of the variety of ways that you could schedule a COVID-19 mobile clinic with us, and kind of explain the differences between all of the many things at PCHD that do that. And their ability to field mobile services is a little bit more tricky, especially with everything going on right now, including monkeypox. My team is kind of the go-to team for scheduling those mobile clinics. Another resource we have is a third-party group called PMG, and my grant actually pays for that group, and they provide more large-scale mobile vaccination events and flu, depending on the season. So what I did want to talk to you about is about my grant. And so we recently rolled out this email that you can see on your screen called Vaccine Equity Scheduling at pima.gov. This is a group email that's directed at me, my co-coordinator on this team, and my program manager. And this allows y'all at the schools to reach out to us to inquire about any mobile COVID-19 vaccinations you have interest in. If there's an expressed interest from your students, faculty, parents, anything like that, you can definitely reach out to this email and let us know that you're interested. We can field availability and discuss scheduling with y'all, what that looks like, logistics. So if you ever have any inquiry to host us at your school, we would definitely appreciate the opportunity. Like I said, we've done a couple thus far, but I know it can be challenging and there's a lot going on right now at back to school. So I just wanted to hop on, introduce myself, and let you know that we have this email available if you guys are ever interested in hosting us and having mobile vaccines at your school. We do vaccines, primary doses, and boosters. Does anyone have any questions for me specifically, really quick, before I hop off?
There is one question in the chat. Does asking which vaccines you'll be providing. So this is specific to COVID vaccines, is that correct?
Yeah, great. Yeah, so we have all the major, we have Pfizer, Moderna, and Janssen. Yeah, we only do COVID-19 vaccinations and boosters.
Perfect. Thank you so much, Des.
Thank you, guys. I appreciate it. Bye-bye.
Bye. Yes, and so if any of you would like to host a back to school clinic, definitely reach out. And youth are still some of our lowest vaccination rates among our community. And so, especially for the younger kids, we would love to increase those vaccination rates. Also, just to make sure we have all the correct information from your school. I know there's a lot of staff changes that happen over the summer, so if you feel like somebody is not on this call that should be, please reach out to schoolsupport@pima.gov to get them on the call invite and our contact list. All right, let's dive into COVID. So as of
him, child.
Oh, sorry, let me just mute real quick. So as of COVID, or as of August 11th, our community level is low. This is updated on Friday, so it should be updated tomorrow. However, we are experiencing, similar to the rest of the country, really, high rate of transmission. So our current rate is 191 cases per 100,000 individuals. Only about 49.5% of people ages 5 and up are up to date. So that means that they have received all eligible boosters. We have much higher rates than that for folks who received their original series of vaccine. But only about half of our population that's eligible have received their eligible boosters. And then here's a link that will take you to our Pima County page that shows what community level we're at. Here's the map of the US showing community transmission. So as I said, most of the country is still in high transmission right now. However, we are at low community level. The reason that there's such a big difference is when looking at community level, it does take the case rate into account, but it also takes into account our hospital capacity. So earlier in COVID, there was a big fear that our medical system would, quite frankly, kind of collapse with how many people were having to be hospitalized, how many people were dying. Currently, although we do have really high rates of COVID still, our case rate is high, but our death rate and our hospitalization is low. So the hospitals are doing okay right now. Only 3% of our staffed inpatient beds are used for COVID-19 patients. And so that is why our community level and our transmission rate are so different. So the community level does take into account our hospital system. So here is a map for the, sorry, we're having a lot of issues with muting today. I apologize. So if you're not muted, please stay on mute until the end. But our community level map for the whole US, you can see us down at the bottom in green. All right, and for monkeypox, here is a map of the monkeypox cases in the US. We're over 13,000. This data was as of yesterday. Arizona has over 213 cases across the state, and we have 19 of those cases are here in Pima County. As of this point, none of those cases are in children. And just a reminder, we did go over monkeypox guidance last week, so if you missed that, please watch the recording on our YouTube channel because it has a lot more detailed information and some information on how to differentiate monkeypox from other rashes that you may see. But I did want to leave the symptom slide in here just to kind of remind you what we're looking for. It's a lot of kind of flu-like symptoms as well as the pox. And swollen lymph nodes is a pretty significant symptom as well. And those lymph nodes can be in the neck, in the armpit, or in the groin area. All three areas can be affected. All right, so let's talk about the CDC guidance changes. So CDC, we had delayed putting out any really new updated COVID-19 guidance for this school year because we were waiting for the CDC to update theirs. So that has now been updated, and so we just want to go over some of the changes. So as we've talked about multiple times previously, when the emergency order rolled back, it really changed the authority that we have. So we don't have the authority any longer to require quarantine and isolation and things like that. Even our ability to have data reported, all of that has changed. So now a lot more of the pressure falls onto schools and districts to be writing and enforcing their own policies. So just want to drive that home again. We strongly, strongly encourage you to have your schools and your districts have their own written policies. So when you do get pushback from families, you have the policy that you can turn to and say, you know, this is our district policy or school policy. So anyways, the biggest changes are they no longer have the recommendation to cohort students within schools. They have removed the recommendation for students to quarantine at home, except in high-risk settings. So those settings include in jails as well as long-term care, more congregate settings. So if there was like a boarding school with a dorm, that might be more apt to qualify. Social distancing is no longer mentioned or defined, so they no longer define a close contact as somebody, you know, within 3 feet if they were masked or 6 feet if they were unmasked. I think those are still good general rules for identifying close contacts, but it isn't mentioned as a mitigation measure. And then they did remove the test to stay information for us. That was test mask stay. That was our program. And we've already kind of stopped using that because the whole point was to test kids and have them masked so that they could stay in school. But now quarantine isn't really recommended anyway. So that is no longer really relevant. So as far as mitigation goes, vaccination is still the best way to mitigate outbreaks and also severe disease. So getting students vaccinated for COVID as well as for other childhood vaccinations, routine vaccinations, will just help prevent illness and outbreaks of all kinds. As we have discussed a few times this summer, if you were able to join us, our rates for just routine childhood vaccinations are also declining a bit. And so we just want to make sure everybody stays up to date on all of their routine vaccines as well as COVID, just to keep as many kids safe and healthy as possible and in school. For ventilation, purchasing things like a MERV 13 filter or a HEPA air filter. HEPA is kind of the gold standard, but a MERV 13 filter is similar and still effective for things like COVID. It's just not quite as high level of filtration as a HEPA filter. Using portable air cleaners in classrooms or ultraviolet irradiation systems that can sanitize air and surfaces. The EPA has a clean air in buildings challenge that gives you some steps to help optimize your indoor air quality. So we've linked that here, and you can you'll receive these slides in your email today or maybe tomorrow. But we have linked that there for you. It gives you some actionable steps that you can kind of work through with your school to help optimize your air quality. Increase outdoor air intake, so opening doors and windows, particularly this has always been recommended on school buses, so keeping windows, obviously not doors, but keeping windows open while students are on the bus just helps with air circulation and getting fresh air in. And then holding activities outdoors when possible, especially if they're a little bit larger group. And we're lucky to have really wonderful weather here in Arizona, not right now, but for most of the school year. And then hand washing remains an important mitigation measure for all sorts of illnesses. So teaching and reinforcing proper hand washing with your students, having hand washing breaks at key intervals before and after meals, after using the bathroom, after recess, just make it a part of your routine within your classroom. Teaching younger kids, of course, to cover their coughs and sneezes, and then keeping hand sanitizer stocked in your classrooms and hallways and bathrooms. And if you have younger kids, being careful about letting them have access to that hand sanitizer that's unsupervised, but with the older kids, it should be fine, hopefully. So then we get to masking. So correct and consistent use of masking still helps reduce the risk of spreading COVID-19. Anyone who has a known or a suspected exposure, so this would be like a close contact, should mask for 10 days from the date of exposure. The date of exposure would be day 0. So for 10 days, they should mask regardless of what their vaccination status, regardless if they're up to date or just have their original series or they're unvaccinated, and regardless of prior infection. So even if they just had COVID a few weeks ago, if they've received a known exposure and they're identified as a close contact, they should still be masking for those 10 days. Schools can rely on quarantine instead of masking. Again, this comes down to what written policies your school or district has. Quarantine is still an option, but the CDC and the Pima County Health Department and your schools all really have the goal of keeping kids in school as much as possible. And so that's why this change has happened. If you do rely on quarantine instead of just the 10 days of masking, you can also use the test to stay to help kids stay in school more. Masking is recommended at all times in the school nurse's office because the school nurse's office is seen as a healthcare setting. At the medium and high community level, so just a reminder, we're still at low, but we have been going back and forth between medium and low. So at medium or high community levels, masking is recommended for anyone who's immunocompromised or just at higher risk for that severe illness. At a high community level, universal indoor masking is recommended for all schools. So we have not been at a high community level since the community level started, I don't believe. But if we get to that level, then universal masking is recommended in all schools. Schools with high-risk students should make modifications to ensure that people have access to in-school or in-person learning, including those at high risk and those with disabilities. So considering things like having entire classes mask or whole schools mask or masking for large group activities or increasing social distancing, all of these kind of layered mitigation to help protect those who are at the highest risk among us. And if somebody has a disability, then including accommodations for them, they're unable to mask in their IEPs or 504 plans. Schools can choose, again, all of this comes down to kind of being optional now. So schools can choose to have universal masking if you feel like that is what will better serve the families in your school. And we do recommend masking in any indoor situation, social situation with people you don't know. So that's a little tricky in schools because everybody kind of knows each other, but we are still recommending masking in indoor gatherings. All right, more mitigation. So surface cleaning. The CDC recommends disinfecting surfaces at least once a day. Or if you have a classroom where students or staff are eating, or if you have students that are that wear diapers that are having diaper changes and things like that, then of course disinfecting those areas after contact with any bodily fluids. I've linked for you the EPA products that are recommended for killing COVID-19, but if you have additional questions on which products are appropriate, then feel free to reach out to our Community Health and Food Safety team, which is CHFS. We call them chefs, chefs@pima.gov. And they also have been on and have done some good presentations on norovirus and cleaning for that as well. So if you haven't seen that, if you were not part of that meeting, check that out on our YouTube channel. The recording is there. So if somebody who is COVID-19 positive have been in your facility in the last 24 hours, then the facility should be disinfected overall. And there's additional cleaning guidance for cleaning your facilities from the CDC that is linked here. Anybody who is feeling sick should stay home. So this includes respiratory or gastrointestinal symptoms. They should all stay at home. If it seems like it is potential to be COVID, then you are welcome to test for COVID, and we'll get into a few different methods of testing. But whether they test positive or not, if they are sick and experiencing symptoms, they should stay home until their symptoms have resolved. And some of this can include creating flexible sick leave policies for staff, for them to be sick, or if they're caring for a family member who needs to stay home sick. So that is one thing as well for districts to consider when creating these policies. All right, for testing, there's a few different methods. So one is diagnostic testing. So that's for people who are experiencing symptoms. For diagnostic testing, you kind of have three options. So one is performing a CLIA-waived test within your school. So if your school has your CLIA waiver and they have tests, then somebody on your staff, that they don't need to be medical, but they can perform that test. Another option is giving a student or family an at-home test and requesting that they take that test at home. Or the last option is referring them to a community testing site, which we still have a lot of more public testing sites, but we also have one that is sponsored by the county that is still open. So there's a link to help you find where those testing sites are. If you're giving them an at-home test and they don't speak English, we have test instructions of how to perform the test in lots of different languages on our website. And so I've linked that for you. And then how to report the at-home test results is also linked here. And then there's screening testing. So this would be widespread testing for folks that aren't necessarily symptomatic, but it should include both vaccinated and unvaccinated individuals. And this is encouraged at multiple times throughout the school year. So this could be for participation in higher risk activities like close contact sports or other extracurriculars. Or it could be at key times of the school year. So when folks are coming back from break, whether that's spring break or holiday breaks, or prior to large events, maybe before prom or graduation or other large gatherings, you may want to do some screening testing before that begins. And then anybody who tests positive should follow the isolation guidance, which hasn't really changed. Your date of positive test or date of symptom onset is still day 0, and then you should remain isolated for 5 days. You can either test to get out of isolation at that point, or if you've had no symptoms, mask for 5 additional days. If you do continue to have symptoms, then you should isolate for a full 10 days. So for reporting cases, CLIA-waived tests that are performed at school, they do have to be reported to the state. So because under the CLIA waiver, you are acting as the laboratory running the test, it's a little different than what's required normally for school reporting. So novel coronavirus is a required communicable disease report for providers, even though it's not a normal requirement for schools. So because you're performing the test as the laboratory or provider, then that is required reporting to the state. So we do recommend that you gain parental consent before performing this type of test or reporting, just to because FERPA does protect student information from being shared. We recommend gaining parental consent. So we don't have a specific consent form. We don't need those consent forms. That is just for protection for you as a school. So whatever that would look like for you. And then there's at-home tests. So these are performed by the family or by the student themselves. This can be reported to us as part of a possible outbreak, but we don't need any detailed information, although we do encourage the family or the student to report it on the self-report form online, which on the next slide, there's links to all of this stuff. So close contacts are no longer required to be reported to the county because masking is encouraged for people who have known or suspected exposures. We do encourage you to identify students and staff within your school that have had close contacts to new cases and encourage them to mask for the next 10 days. So you don't have to report any close contacts to us, but we do recommend you self-identifying them within your schools. All right, so here, this is kind of a breakdown of the reporting. So if it's a CLIA wave test, this has to be reported to ADHS, either through their online form or through Simple Report. Either one will report it directly to the state. So there's 2 links there. For the at-home tests, those should be reported through the self-report form, which is also linked here. And then for any test, whether it's an at-home test or one of the CLIA wave tests, you can also report it to us through our new outbreak reporting portal, which we're going to have somebody go over with you in just a minute to show you how that works. This is also linked through our new webpage at pima.gov/healthy-schools. But this portal, you can just put in possible outbreaks and case counts, and you don't have to include all detailed student information. So you're not breaking any rules with FERPA. So I'm going to go ahead and hand it over to, I believe Enos is here, or Amanda, to kind of walk through this new reporting tool that we have.
Okay, yeah, give me 1 second to pull it up over here on my side. But
perfect. I'm going to stop sharing real quick, Enos, so you can share your screen.
All right. Or if you can pull it up and I can just talk and you want to drive, either way. Oh, either way. Let's see. Do I have all right. Share. No, I'm not allowed to share screen.
Okay, I will pull mine back up real quick. I apologize.
Oh,
All right.
All right. Okay, so to start off, so we kind of the idea behind this is we're generally going to build it to be it's like a general reporting tool for not just schools but for anybody out in the community. So schools, long-term cares, child care facilities, businesses, et cetera, et cetera. And so right off the bat, you just facility location type. So like you guys would pick, school, public. So we've got all the public, private, charter schools in one list. It is an auto search box. So if you were at like, I don't know, like Booth or something, or you could just start typing the name of your school and it'll auto search what's in the list. If your school isn't in the list, there is an other, you can just pick other and we'll comb through the results that we get. And any facilities that are flagged as other, we'll add them to the overall searchable list as we go. But yeah, just pick your facility, then next. And so contact info, so this would be your info, first name, last name. I think we have facility information on the next screen. Then if you want to list an alternative contact, you could click yes there, and that'll give you just a repeat of the same set of fields. And if not, that's fine. All right, so when you get to this part, so correct me if I'm wrong, Kat. So yeah, so we kind of set it up to you could either do single cases with the case detail, i.e. name, date of birth, et cetera, et cetera. So when you pop that, you do have to hit the add case button the first time. But then you just fill out the information as listed there. And if you need to add additional cases, there's an add case button at the bottom. You would just click that and it will add another set there. So you can put in the second case's info, And you can add and remove dynamically as you go. And so working with our contact tracing department, these were kind of the elements that they flagged as what they really like to have or needed from the case info. So you just fill in the appropriate. Let's see, most of it is about the same info that we'd seen before that was on the previous survey and the line list. So the date of symptom onset, last day of attendance or last date on site. You guys can ignore the admission date because this is like going to be geared towards not just schools, but for businesses and other facilities out in the public. And then I think all we're asking for is the person symptomatic or asymptomatic, and then no test requirement or any of that stuff like before. So hopefully this speeds it up and makes it a little easier for folks to fill out. And like I said, if you have more cases, you can just hit the add case button and then add a second one. And then, did you want to look at the outbreak?
Yeah, so just a reminder. So this would just be for those CLIA wave tests that schools are performing, that you have consent to report this information to us. And then this other option, the possible outbreak, this would be more for maybe parents have just called in and told you their kid was COVID positive, or it's not a test that you are performing. Maybe they did an at-home test or something like that. It would fall under this possible outbreak category. So just wanted to clarify that for you.
And then the info requested is slightly different. So it's just more of total number of individuals, the setting, and then just dates, like the onset date for the first case. And if there's multiple cases involved that you know of, the onset symptom date for the last case. Excuse me. And then the last date of attendance for the first known and the last known cases. And then if you have multiple, you can just hit add outbreak and add another set. If you had like 2 or 3 classrooms or, something to that effect. And that's pretty much it for case reporting, I think, because I think next just takes you to the submission page.
Perfect. Thank you so much for walking us through that. And I just wanted to show where we can get to this. So if you go to pima.gov/healthy schools, which is our new webpage, and go to school or COVID-19 resources, at the bottom, there's one for school professionals. And this is where it's linked here under report a case or outbreak. So that's where you can find it on our webpage. So thank you so much, Enos, for walking us through that.
Very well.
All right. So outbreak response. I know we're over on time, so I apologize. We are almost finished. So if you can stick with me, then great. So strategies during an outbreak, masking is always going to be important during an outbreak to prevent spread, improving the ventilation, moving any school activities outdoors if possible, performing screening testing to screen even if they don't have symptoms, and then performing case investigation, contact tracing. So we will still be doing case investigation here for the reported cases we receive. And then as far as contact tracing, since you're not reporting any close contacts to us, the most important thing would be identifying the close contacts within your school and then asking them to mask. Early identification of cases does help with outbreak response as well, getting students and staff who are sick out of school as quickly as possible. And then consider suspending higher risk activities. So if you, the entire basketball team is getting COVID, then maybe canceling or postponing any games until that outbreak kind of subsides, or, choir concerts, things like that, which we know is disruptive. But if you are experiencing a larger school-wide outbreak, then that is one of the mitigation measures would be to suspend those activities. And then as far as after school activities go, at a high community level, which again, we're still at low, consider implementing screening testing, for any indoor sports or close contact sports or other extracurricular activities. Consider stopping these when there's an outbreak, and then use layered mitigation whenever possible, such as masking, hand washing, social distancing, and increased ventilation. Here's some additional resources. There's a lot of links throughout this whole presentation, but here's some additional resources on both COVID and monkeypox. It also has our test kit request link. So if you do need test kits at your school, you're welcome to request them there. And then here's our contact information, our new website, as well as our school email and phone number. We are quite short-staffed at the moment. We still continue to work on hiring some folks. So please be patient with us, but we are returning all of those inquiries as quickly as possible. So that is all I have for today. We are over on time, as I suspected, so I will let you all go, but we will get all of the questions out of the chat and include them in the follow-up email as a Q&A portion so that you are able to get your questions answered. So thank you so much for joining us today and sticking with us through this presentation. Please reach out if you have any questions or if you need to reach us for anything. Thanks so much. Have a great rest of your day.